विवेक गुप्ता कार्डियोलॉजी दिल्ली अपोलो से 6 जुलाई को एक छोटा सा यूट्यूब के माध्यम से आपको बताना चाहते हैं वैल्वुलर हार्ट डिजीज़ में एओर्टिक वाल्व डिजीज़। एओर्टा valve disease is actually a disease which leads to aortic stenosis. It is a degenerative heart condition mostly found in the adult population or elderly population more than 60. These patients have a aortic valve which is stenosed. That means the valve area, which is about 2 to 3 to 4 centimeters square, turns down to 0.5 or 0.1 or less than 1 centimeter square. Aortic valve is a valve through which the whole of the blood passes from the ventricle of the heart and supplies to the whole of the body. Aortic valve stenosis leads to symptoms of syncope. Patient can fall unconscious, especially on running or exerting. It can lead to ventricular tachycardia, ventricular fibrillation or sudden cardiac arrest and death. And it also leads to heart failure, which is a weakening of the heart muscle. It's a very important condition. If not treated, the patient will die within 2 years' time. Normally, we are treating this patient with the opening of the chest and placing another artificial valve, which is aortic valve, surgical valve replacement. But in many conditions, when the patient has got comorbidities, especially more than 75 years age, the patient has diabetes, heart conditions, poor LV functions, or diseases related to post-bypass surgery patient, or kidney disease or lung disease, these patients become the high risk for surgical valve replacement, and many times the surgeon decline to do surgery, considering that the patient can have severe mortality or morbidity post-surgery or during surgery. These patients are left on medical treatment and they will surely die within few weeks, few months or few years. The non-surgical valve treatment, which is TAVI, transcatheter aortic valve implantation, was first developed by Professor Dr. Cribier in France, my mentor and very close friend of mine. In April 2002, the first case was done. After that, the companies grew and more innovation took place, and nowadays a TAVI, transcatheter aortic valve implantation, is a common practice and being done in most of the hospitals in Europe, America, and FDA, which is a federal drug agency, has also approved it, and of course it's very common in Europe. So transcatheter aortic valve implantation is a now alternative to surgical aortic valve replacement, and we are also doing in Apollo Hospital, Delhi. And want to tell you that this is a non-surgical, no opening of the chest. It's only through the valve, through the groin, we put the valve and the valve is replaced or deployed another valve. Thank you very much, Dr. Gupta from Apollo on 6 July 2020.